Would you like to introduce yourself and tell us what your job is at Lugulu Hospital?
Okay, I'm called Dr. Mohammed. I am the medical doctor in charge. I'm also the CEO of the hospital currently for Friends Lugulu Mission Hospital.
My name is Sarah Lookabill, and I'm currently the assistant presiding clerk for Friends United meeting. And yes. That's why I'm here today. Tell me a little bit about the history of Lugulu, and how does that inspire you today?
Friends Lugulu Mission Hospital, I think, is one of the biggest mission hospital in Western Kenya. Not even apart from Western Kenya, I think the remaining biggest level 4 hospital, Friends, I think, a hospital in Kenya. Friends Lugulu Mission Hospital has been in existence for many years. Let me say roughly around 100 and something years. I think if you look at the history of Western hospitals, Western county hospitals, it is one of the oldest living hospital, mission hospital. And out of that, we have a bed capacity of up to 120 bed capacity patients. They have a theater. They have surgical departments. They have obstetric and gynecology departments, pediatrics. Then we have also outpatient services where they conduct clinics, emergency and accident cases, SOPC, surgical outpatient, MOPC, surgical outpatient, gynecological cases. And then recently we have also introduced an orthopedic department where we will be having all cases of road traffic accidents to be reviewed within the hospital. Also, we have other paramedics like ambulance services, which we normally assist the community with. Apart from serving the hospital, they normally also go beyond this county. So those are the key areas. The hospital serves more than around 1.5 to 1 million cases. Clients range from different facilities. And in that hospital, we have close to resident 5 doctors. We have also visiting doctors, mostly specialists, orthopedic, gynecological, and then sometimes once in a while a physician, and then an eye specialist who comes and visits us to see patients on Tuesdays and Wednesdays. So those are the key areas where we normally specialize with. Sometimes also we have community-based outreach where we reach our friends, the Quakers, especially the Quakers, where we collaborate with the church. The communities are really supported through the hospital, where if they don't have money, they can be treated, and through the program of FUM, adopt a bed, where they can be relieved of because of this condition. I think previously, even before COVID-19, you will find most clients who are attended to this facility, they are very poor people. So the hospitals waive them through adopt a bed, through programs that are also placed by FUM. But there is also a very crucial department, that is the clinic, the CCC department, comprehensive care for the HIV and immunocompromised patients. Those ones are supported through CAP, KCCB, but also they get some support from CDC. So that is also another department which is running within the institution. I think that is an overall perspective of how the hospital works in terms of their normal. So also the hospital is a 24-hour hospital, and no mother is returned because of either delivery or postpartum. We don't refer our mothers who are about to deliver, those ones with maternal. And the only things that we deliver is very complicated cases for dialysis and specialized care. Those ones with severe head injury, dialysis, and rheumatological conditions which are beyond the hospital scope. Those are the cases we normally refer.
Wow. You, well, first of all, you've answered all my questions, I think. No, I have a few more, but
Yes.
I'm aware of you, Lugulu Hospital. I've been, I actually have visited there one time in 2002, but I did not have a very good perspective of how busy you are and what a large territory you cover, and the number of patients that you serve and the number of specialty services that you offer to them. So I'm really impressed, and you're doing a very difficult job, and thank you for telling us all about it.
Yes.
Share something that brings you joy in your work, or something you've run into with patients, or anything like that. A joyful experience.
Yeah, that is true. I think for me as a doctor, I think that is a call in itself, by itself, where I see patients, I listen to them, and I share with them what they pass through, both the psychological, social, economical issues which we have on this end. But most of the patients we attend to, once they are satisfied with what we do for them, and this one will give us a great joy. If a patient is admitted and he has been with us for the last, let us say, 5 days or 7 days or 10 days, let us give an example, bacterial meningitis, and the patient has been in coma previously, we had managed him properly, discharged him properly, that will give us a great relief as a hospital. We say, we thank whatever we are doing as a practitioner, apart from giving our best. The other thing is that being in the line of duty, delivery mothers, attending to a new babies born every day, that is a sign of a joy, because we are receiving bundles of babies. Bundles of babies. If we can deliver close to 180 mothers, 180 babies are born every day, and we see such kind of, without severe complications, we feel so happy as a hospital that at least we have done. And these are not few people. There are people, sometimes when you look at the patients who had appeared in the hospital, and they give you the history of Lugulu Mission Hospital, how they have been assisted. This one also gives us, I remember I saw one of the consultants, I saw one of the gynecologists. He told me when he was young, his father didn't have any, support from anybody. So what he used to do is that he used to supply small milk to the institution. When he fell sick, he was treated for free. He used to provide that milk when he was young. So the hospital nurtured him. Then through his career, primary, secondary, then went up to university, the milk he was supplying to the institution really helped him to become a doctor. And today he is also a gynecologist, a specialist gynecologist. So when you interact with people and listen to such kind of stories, you will really say that Lugulu has nurtured a lot of people. Apart from that, there are many politicians, lawmakers who had been, passing through the hands of Lugulu Mission Hospital. I think when we see them, ministers, members of parliament, governors, saying that, well, I remember my mother gave birth to me through Lugulu Mission Hospital. You feel happy. You say, why can't you now bring back to Lugulu Mission Hospital? So those are the joy we normally share. Apart from that one is also, sometimes the community we have, they are poor community. When we see their relief of those debts as medic, they are not affected or psychological effect because of looking for money, we feel happy. Because my patient is happy, I'm also happy.
Yes.
Yes.
Sometimes it's hard for us, like in the U.S., to know how the money that we give for something makes a direct impact on someone's life. And I know you mentioned the Adopt a Bed program, and that's a program that people really too. Can you tell us about a patient that may have been changed by having the adopt-a-bed program available for them?
How much they are? Sorry.
Could you tell us about a patient that has been part of the adopt-a-bed program and how that money has helped them and also helped the hospital because it helps your bottom line financially? Can you talk a little bit about that?
Yeah, very true. I think it is not only one patient. There are several where we have, we have debts where the hospital, as a rule for us as a hospital, when we find a patient who cannot afford money to go to a referral center, let us say they were supposed to be referred from Lugulu to another center which is around 500 kilometers or 300 kilometers, and they could not afford to pay the transport, we normally assist them through the adopted bed program. And then there are patients who are admitted, and most of these patients sometimes they could not afford it because either the person who brought the baby is a widow or the husband, they have separated. So what the hospital does is that they have somebody who is responsible to listen to these clients. They normally visit our debt collector office. There, when he will assess the situation of the person. Then, after getting the detail, he will liaise with the area chief. They will visit the homestead of that person. If they see that this is a genuine person who can benefit from this money, then our debt collector will come and inform the administrator that we have so and so who is completely unable to pay his money because you can even see from the clothing the person is putting on. The homestead, when you go there, they could not afford to even cook a meal. This one you will say, okay, as a hospital, we will utilize the money for adopt-a-bed to clear his bill. So sometimes, as a hospital, sometimes the bill is so big. So we also sacrifice as a hospital to also give back to the community, and then see the little we have with also adopt-a-bed, we combine. If we say we will utilize all the money for adopt-a-bed, it will end within 1 day or 2 days. So we go for necessity plus, as a hospital also we have a criteria where we have played. Even if you can pay 40% of the money, then the rest 60% you will pay slowly by slowly according to how you can afford. And then we also sometimes involve the chief where their family members are informed so that they can contribute, even if it is $1 or $2 every 2 months or 3 months. So that is how so it goes with priority. Where we find that this person is completely poor and it has been assessed, then we effect the adopt-a-bed's money.
That's good information, and I appreciate that. I know people will be interested in hearing that. Yes. What are your hopes and dreams for Lugulu Hospital?
I think for Lugulu Hospital, the hospital has been in existence for many years. And I think a lot of people have passed through, those ones who are alive and those ones who have passed on. And the hospital, I think the person who started had a mission, which is bigger than most of us. The person who started the mission, his vision and dream was bigger than most of us, because whatever he has implanted planted as a seed today can serve many communities. I remember when I heard the story of Lugulu, it was started as a makeshift where you can bandage somebody who has got injured in a football match for mostly secondary schools which are close to the hospital by that time. It was started as a small makeshift to treat, give tetanus, bandage, first aid. But today, if you look at it, it is a level 4 hospital. But as a mission hospital, we have not reached to the standard that is wanted. But every day we strive to improve on service delivery, the quality of service, and then improving the welfare of those who are working for Lugulu. There are staffs who have worked for many years. They have given to they have given to Lugulu, they have sacrificed without even being paid for many months, but they have really persisted, and some of them, they have stayed close to 40, 50 years, 60 years. If you look at their story, even for somebody who is young and joining the career, you will say, how can I punish myself? But if you look at their hope, they will give you and say that this is a Quaker hospital. We have faith that our children have been educated because of the little we get from the Lugulu Mission Hospital. But as an administration currently, what we wanted is that the hospital has the old face. The infrastructure is the same infrastructure which has been persistent for many years. And if we wanted as an institution to go to another level, I think as a hospital, we are also planning with our donors, our supporters, to come up with a plan to make it to a standard where we can say that we have reached. But it needs more improvement, more finance, and God willing, I think with time, what we wanted also the diaspora committee, our friends all over the world, to concentrate on how to change the face of the Lugulu Mission Hospital, as much as the ones who are on the ground can give the quality, support, and the psychological, the spiritual, everything that's available to the community. So my vision is to say, my dream is to see Lugulu grow, become a level 5 hospital. Level 4 hospital is a big hospital. Level 5 hospital, they can offer the services which are required in terms of dialysis, in terms of ICU, in terms of modern structures. Even if somebody is admitted, a minister can be even admitted in Lugulu today. I think those are the things we dream of. As a hospital also, we are taking some measures where we are building a new modern theater, from the previous one. So we had placed some small amount of money to start building as we ask for fund from outside. So that is one of the dreams. Even what I see it is the infrastructure, and if they can get support in terms of human resource, where they can chip in, people can assist in terms of paying salaries to staffs, and then sometimes they can be relieved of medication, supply of medication, because most of our patients are poor. You will find you have bought this drug again, you need to give it for free, and this money, I think in a month, I think the budget for pharmacy alone, not even pharmacy, the pharmacy alone goes up to, I think, around $50,000 for medication alone. If they can be relieved of that one and the salary, I think the hospital can do a wonderful job. A wonderful job.
Friends United Meeting has a global impact fund, and which allows us to use donor gifts where they would make the most impact at places like Lugulu Hospital.
Yes.
Tell me about how Friends United Meetings support is important to you in the hospital.
I think, let me say, because for Friends United Meeting is one of the pillars of the hospital. Without them, I think what I believe when I joined this hospital, even for me who is new, I was hearing about FUM. And I've been really interacting with Sean, Katrina, Mohammed, and the other team. I think the other team who are in Kisumu, sometimes we communicate. And I believe they are part of the hospital where we will be having every board meetings. They are invited, they come, we share. And luckily, I remember Sean was the one who even inaugurated our new kitchen. He was the one who was officially opening our new kitchen. So I believe they are part of the hospital, and the support they have given to the hospital cannot be measured by today. I cannot say, and I cannot sit and say that it is 1, 2, 3, but it is an immense support. The latest we received was the money for COVID-19, which we received a donation through FUM, which we really appreciate. And through them, we also received other donations, I think from Kevin Quinn, who bought for the hospital an autoclave where they are utilizing it properly. I think through them, we are also receiving students from different parts of the world, others requesting through FUM. And I think our board member, one of our board finance chair, was Francis Makete. I believe he's also the treasurer for FUM. But in terms of support, financially, spiritual support, and even the moral support where we have been receiving from the team through FUM, emails, give us an update on COVID-19. I have been receiving every week, so which we have been sharing together to the FUM family. I think I cannot say it is a mutual relationship between the hospital and FUM. I want to say lastly, the FUM community, we really appreciate them, and we really appreciate their support always.